Chairman, we are ready to begin.
Oh, good. Thank you, Denisha. Would you call the roll, please?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Nelva Lee,
Here.
Shane Mobley,
Here.
Robert Coles,
Here.
Anthony Williamson. Anthony Williamson. Chairman, we received notice that he will join, so maybe he will momentarily. That concludes my roll call.
Yeah, I think Anthony's having maybe some technical issues there this morning. Well, welcome to everyone, and thank the board members for taking time to join our meeting and participate in our meeting this morning. We have a quorum to conduct our business as per the agenda. Our agenda this morning includes a couple of items that we'll be asked to consider for a vote. And the one that will be the final approval, and the other item, initial approval, and those will be presented by Brian Dowd a little bit later. We also, importantly, in our meeting this morning, will be asked to listen to a presentation on the state health benefit plan and be asked to vote on 3 resolutions as it relates to that following that presentation at that time. Traditionally, we have 2 meetings in August traditionally, and the emphasis of this first meeting in August has always been mainly the state health benefit plan, and the second meeting will be budget. So this morning, first item on the agenda is the minutes of the previous meeting. And I'm going to ask Vice Chair Russell Crutchfield if he has had a chance to review those minutes and would recommend approval.
Well, good morning, Mr. Chairman. I have had the opportunity to review the July 13th, 2023 Board of Community Health meeting minutes. I have found them to be correct and in order, and I move that we approve the July 13th, 2023 board meeting minutes.
Recommendation for approval of those minutes. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, the minutes are approved. With that, a meeting that took place prior to this morning was the care management meeting. And I would like to ask Lynette Rhodes if she would give us a report on that meeting.
Good morning, Chairman Boyd, Commissioner Carlson, and members of the board. We did meet this morning. We presented an update on Medicaid and Peach Care for Kids redeterminations and shared some of the results from the July redeterminations. Informed the committee that those reports are also available publicly and that CMS is also going to be sharing information on redeterminations from the results nationwide, and then also emphasized provider revalidation requirements. And again, just reminded everyone of the need for providers to complete that process by September the 15th. And then just a high-level summary about the pathways to coverage waiver. And that completes my report.
Thank you, Lynette. Are there any questions or comments from the board? Hearing none, thank you for that report. And I will turn it over to new Commissioner Carlson for his report.
All right. Well, thank you, Chairman Boyd. Thank you, members of the board who are not present today and watching us virtually. I'm honored to be here. I also want to thank Denise and our team who puts meetings like this together. It's never lost on me that these things don't just magically come together. So thank you for your work and preparation. It's obviously an honor for me to be here this morning. I'd like to thank Governor Kemp for this opportunity, this very humbling opportunity to serve as your next commissioner the Department of Community Health, having taken the oath just over a week ago. I'm fully aware that I have big shoes to fill, having served as Commissioner Novel's Chief Health Policy Officer for the past year. So I had a front row seat for her great work each and every day. I also want to thank her for her 20 years of service to the state as a whole, not just DCH. And I'm hopeful that she'll allow me to still call her and seek her counsel or just good old fashioned help as we work through these issues day to day. It's an honor to be entrusted with such a responsibility, and I can assure you it's a responsibility I take very seriously. As for priorities, the agenda before us writes itself. Look no further than the task before us now. As we sit here today, we're in the process of working alongside our sister agencies to manage the unwinding of the public health emergency and redetermining the eligibility of over 2.8 million Medicaid recipients here in the state. As we are standing up the governor's signature Georgia Pathways to Coverage program and preparing for some of the state's largest procurements, to include our managed Medicaid plans and the state health benefit plan, all at the same time. Not to mention the day-to-day adventures surrounding an agency as broad and complex as this one. While I can assure you I have a healthy amount of respect for the work that lies ahead of us, I remain optimistic about the future. And I'm optimistic about the future because I believe in our DCH team. I believe the team is up to the task and doing the hard work each and every day while no one's looking, because they're unified in their belief of our mission. And I look forward to supporting this team in fundamental ways to build on the progress we made, celebrating new successes, and working through challenges together for the benefit of vulnerable Georgia residents. Speaking of team, I'd like to introduce several new members of our team. They didn't know this, so I hope they have their speech ready. Grant Thomas serves as our Deputy Commissioner, coming on board August 1st, as I did. Grant has several years of state service and government service, many of which are in healthcare specifically. And he recently served as the governor's first director for the Office of Health Strategy and Coordination. Thank you, Grant. Cody Whitlock, holding up the back wall there, joined us as the department's new Chief Financial Officer. Cody recently served as our Division Director for Health and Human Services at the Governor's Office of Planning and Budget. Thank you, Cody. And then, not by any means a new name, but a new role for Lynette Rhodes, who was named DCH's new Chief Health Policy Officer, where she will continue to have oversight over the state's Medicaid program, among other duties. And you just heard from her previously. We are glad to have them in these positions and thank them in advance for their meaningful contributions to the DCH team. So lastly, Mr. Chairman, I'd like to transition and continue the tradition of Commissioner Novel and others by taking just a second to celebrate and acknowledge some impressive employee milestones throughout the department. Tracy Frost in financial management just reached 5 years. Terry Faulkner Passmore in Medicaid just reached 5 years. Leah Lee in financial management just reached 10 years. Terry McFadden Garden at the Board of Healthcare Workforce reached 10 years, as did William Kemp at the Board of Healthcare Workforce, reaching 10 years as well. Yamsrak Tega in the Office of Inspector General just reached 15 years. Katanya Reynolds at the Composite Medical Board just reached 15 years. And drum roll, Matt Gerard in the Office of Information Technology just reached 25 years. And I think I join everyone else here saying, Matt, please don't leave. And and thank you to everyone mentioned for their years of service. And we are grateful for that, and don't take their tenure for granted. So with that, Mr. Chairman, I'll hand it back to you for the.
Thank you, Commissioner. Are there any comments or questions for the Commissioner from the board, please?
This is Shane. I just wanted to tell the new commissioner, we appreciate you stepping up and fulfilling this role. And I look forward to working with you and really excited to where we're going to be going. So thank you again. and we really appreciate it so much.
Thank you, Ms. Mom.
Thank you, Shane. Any other comments or questions from the board, please? Hearing none, we'll move into the items pertaining to medical assistance plans. Then there are two presentations here. The first we'll be asked to consider for final adoption, and the second initial adoption, and Brian Dowd will make that presentation. So Brian, you may proceed.
Thank you, Mr. Chairman, Commissioner, and members of the board. I am presenting today for final adoption, an elderly and disabled waiver program and independent care waiver program amendment to increase all services in the waiver by 0.5%. At the June DCH board meeting, DCH proposed to increase provider reimbursement rates for all services within the elderly and disabled waiver program and the independent care waiver program by 0.5%. Effective August 11th, 2023. Pending DCH board approvals and Center for Medicare and Medicaid Services approval. In the 2022 legislative session, DCH received funding to help cover the cost associated with fingerprinting requirements for provider enrollment, specific to both the elderly and disabled waiver program and the independent care waiver program. In 2022, both the waivers were pending with the Centers for Medicare and Medicaid Services for renewal. CMS does not allow amendments to pending waiver renewals. Both elderly and disabled waiver and independent care waiver programs are now renewed for another 5 years, which allows us to move forward with these proposed amendments. An opportunity for public comment on the proposed change was held on June 14th, 2023 at 1 p.m. via Zoom audio. Additionally, individuals wishing to comment in writing on the proposed changes were allowed to do so on or before July 10th, 2023. DCH received no oral comments at the hearing. DCH received one written comment from Dave Lamb, who is the legislative chair of the Home Care Association of America. Mr. Lamb noted the Home Care Association of America's support for the rate increase associated with helping to cover the cost of fingerprinting. He expressed gratitude for the rate increase on behalf of his providers. Mr. Lamb also noted that additional rate increases were needed to meet the rising costs of our providers in this space doing business. Mr. Lamb provided a 24-year analysis of cost of living to show a deficit in the required business expenses to cost of living. Mr. Lamb also noted that DCH is undergoing a rate study for both the elderly and disabled waiver and independent care waiver program and does expect the rate studies to show a need for additional increases. We at DCH would like to thank Mr. Lamb and the Home Care Association of America for their support of the proposed rate increase and waiver amendments. DCH recognizes the concern as to future rate increases and is working to finalize the rate study for legislative consideration and funding considerations. I'll pause at this time for any questions and would respectfully request final adoption of the proposed waiver amendments to permanently increase rates in the elderly and disabled waiver program and the independent care waiver.
Any questions, comments from the board, please? Brian, I thank you for the work that you've done on this, and thank you for providing the comments from Mr. Lamb and his analysis in the materials provided to the board. We go through these things normally, and it gets to be almost routine, but I know that there's a lot of work, as the commissioner said, goes on behind the scenes, and providing this information to us in advance is much appreciated. Consider. Is there a motion for final approval?
Roger Folsom, motion for final adoption, Mr. Chairman.
Yeah, Mr. Folsom has made the motion for final adoption. Is there a second?
Second, Cynthia Rucker.
Cynthia Rucker has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved for final adoption, and you may proceed to your next item. Thanks, Brian.
Thank you, sir. I am also presenting today for initial adoption a proposed rate methodology change for current procedural terminology or CPT codes 96112 and 96113. DCH proposes to update the payment methodology currently utilized for CPT codes 96112 and 96113 to 100% of the 2022 Medicare rate effective July 1st, 2023. The current rate is set at 84.645%. The methodology will be calculated using the average 2022 Medicare non-facility price for the Metro Atlanta fee schedule for both of the CPT codes. Those two CPT codes are utilized by physicians and physician extenders for cognitive, developmental, and behavioral health screening and testing. They're very important codes for physicians and physician extenders in diagnosing a host of conditions, but particularly autism. The cost impact in state fiscal year 2024 to DCH is estimated to increase funds by $199,579 in state funds, with an additional $401,153 in federal funds, for a total cost impact of an additional $600,732. This funding was allocated in the 2023 legislative session. An opportunity for public comment on the proposed change will be held on August 14th, 2023 at noon via Zoom audio. Written comments may be submitted on the proposed change on or before August 21st, 2023. If there are any questions, I would be happy to answer them at this time, and will respectfully request initial adoption of the rate methodology change for CPT codes 96112 and 96113.
Are there any comments, questions from the board, please? Hearing none, is there a motion for approval for initial adoption?
Russell Crutchfield, motion to approve.
Crutchfield has made the motion for approval. Is there a second?
Second by David Cruz.
David Cruz has seconded that motion. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much.
Thank you, sir.
The next area of our agenda is the state health benefit plan. And Louis Amos will present that as executive director of the state health benefit plan. Louis, please.
Thank you, Chairman Board, Commissioner Carson, and members of the board. I'm Louis Amos, the Executive Director for the State Health Benefit Plan, and I will be making the presentation regarding our recommendations for the 2024 benefit plan year. The overview today, we're going to be discussing the goals for the 2024 benefit plan year. We're going to do a plan overview and talk about market trends. We'll present recommendations for the 2024 plan year, starting with plan options, plan designs, wellness initiatives, member rates, and the open enrollment for the plan year of 2024. The goals for 2024 and 2023, we explored opportunities for additional benefits and focus on maintaining financial stability after the pandemic. We increased our focus on management for programs targeting diabetes, hypertension. As you know, those are probably some of our most costly diseases. And we also initiated a long-term strategic plan review for a member services survey and did a market study on plan designs and health plan management. For the 2024 plan year, we will continue plan options, plan design reviews as we look forward for 2025. Next slide. The plan overview and key market trends, there are primarily 5 areas that kind of influence that. One, from a cost perspective, our annual medical trends have somewhat increased. They were running about 7.5% for 2022 to 2024. They've increased to 8.25. Our pharmacy plan Trends have been
Excuse
running.
me, just about 8.25, is that an annual,
That's an annual, yes, that's it. Yes, sir.
or annual increase in
Yes.
cost?
Yeah, yes, sir. Yeah.
Okay.
And then the annual pharmacy trends at 12.5. I'd like to point out, and specifically for Kaiser, the premiums, they submitted a 9.8% increase for 23 and 24. The other thing we want to really focus in on is that SHPP premiums have pretty much remained kind of flat for active employees and non-Medicare Advantage employees. There was an increase in 2018 of 3.7%. In 2021, we had a 5% increase. But I do want to note in 2019, 2020, 2022, and 2023, there were no employee rate increases. So that's, it's a phenomenal scenario. Inflation, as we all know, inflation is going to play a role in terms of our market trends. And from a healthcare perspective, it's a little bit delayed because the healthcare contracts are typically done for a 2-3 year period. But we will see increases in terms of medical inflation as we move forward. Chronic conditions, I talked about that earlier. As you can imagine, during the pandemic, we had members who had certain chronic conditions, and kind of they delayed the treatment in terms of those conditions. So you can imagine after they have re-engaged into the healthcare system, we're finding that those diseases have basically increased and really kind of magnified to a certain degree. I think the same thing would apply in terms of screenings for cancer and some of those other conditions, whereas the cancers probably could have been caught at stage 1, stage 2, but they are now at a more complex stage in terms of stage 3. And you can imagine the cost that's associated with that. When you're talking about specialty drugs, we hear about the phenomenal drugs that are now being introduced in the market, but it is there's a cost associated with that. For specialty drugs, it attributes to almost 40 to 50% of our drug spend each year. So that's going to increase, obviously, when you talk about the infusion and the injections and the gene therapy that's going to be approved over the next couple of years. I mean, there are certain drugs that may even run as high as $300,000 per patient. So it's quite a phenomenon. So the recommendations for the plan options, our medical vendors will remain the same. United Healthcare will provide an HMO, a high deductible health plan, and a Medicare Advantage plan. Anthem Blue Cross Blue Shield will provide an HMO, an HRA, and a Medicare Advantage plan. Kaiser Permanente will be the regional HMO. The pharmacy vendor will remain the same with CVS Caremark, and the wellness vendor will remain the same with ShareCare.
Louis, the vendor that you're showing there and that we use and the plans that they offer, is there generally what plans are participated in the most, or do you have percentages?
Sure. I have those numbers I can provide for you. I could tell you that the Anthem HMO plan has about 217,000 members. The Anthem Gold plan has about 47,000 members. The Silver plan has about 87,000 members, and the Bronze plan has about 106,000. United Healthcare HMO they have about 18,000 or so, 19,000 members. United Healthcare high deductible plan has about 900,000, and Kaiser HMO has about 40,000 members.
Thank you. So the United Healthcare high deductible plan has how many members?
Almost 10,000.
Oh, okay.
Yes.
Okay, I misunderstood that.
Okay, almost 10,000. All right. Okay, plan design. The recommendations for the 2024 plan year, there's one plan design. We're recommending increasing the ER copay from $150 to $200. I want to remind everybody the ER copay is waived if you are admitted. But you can see that the need for this is to really try to focus our members into either using virtual care, using these urgent care centers, coordinating with their primary care physician rather than just showing up at the ER because of the costs that are associated with the ER costs. Secondly, going to the ER right now, you know, there's a significant amount of wait. People are having to wait hours upon hours in terms of trying to get care. So that most of those services, if it's a true emergency, obviously we want them to go to the ER, but for those services that can be handled in an urgent care environment or primary care environment, we would highly recommend that our members use that. Plus, also, there's an opportunity to do virtual care and nurse call. So those services are available on a 24-hour basis. And then if there's a need to go to the ER, they can instruct the patients to go. So we really want to focus in on that. Benefit enhancements, we implemented on 7/1 of this year, 100% coverage for diagnostic mammograms. And that's encouraging, obviously, our members to get the mammograms done. That was somewhat of a hurdle because they were getting mammograms, and what would happen if a lump was found or something was found, it goes from being a preventive to a diagnostic, and then you're talking about deductibles and things of that nature. So with this 100% diagnostic mammogram, that allows them to get the mammogram done, and then if there's something that's going on, they will still be on a preventive standpoint. The same thing will apply on 1/1/24 for colonoscopies. That was the other issue we were seeing with our members, where they were going to get a colonoscopy. By the time the physician go in, and if he finds a polyp, then that preventive service now changed to medical services because of the polyp, typically if it's removed. So that's going to be covered at 100%. And as you know, colon cancer is one of those things, and also breast cancer on the rise. So we really want to try to address it and get our members to go and have these services done. The other change was recommended for 2024. It's 100% coverage for dilated retinal eye exams by diabetes patients. We want to make sure that they get the eye exam. So these are some preventive measures that we hope will, improve patients' quality of life, but also allow us to manage some of these costly diseases. On the plan recommendations, the only thing you will see here is just that ER copay increase by $50, but all the other plan designs are remaining the same. Wellness. Share Care will continue to be our wellness vendor. They offer the guided programs at no additional cost to the members. It's evidence-based technology, doing unwinding, relaxation, and meditation. Eat Right Now, manage control through cravings, unwinding anxiety, and carving out, focusing in on quitting tobacco and vaping. Member rates. We are recommending to the board for a contribution increase for members of a 5% average on the level dollar subsidy. So the way the rates are set up now, the rates are based on an employee only in the bronze plan. So what we're asking is a 5% increase on the level dollar subsidy. And this will help to make the defined contribution level consistent between the gold, silver, and bronze plan. The premiums will increase on an average of $7.25 per month per employee and $23.61 for employee and family. This amount change will depend on plan option and tier selection. Employees' contribution for Kaiser will have a slightly higher increase because it's a fully insured HMO and it's only offered on a regional basis. I do want to note that these increases are estimate for active and pre-65 employees, but those who are subject to the years of subsidy provision, their rates may be a little higher. So I want to make sure that we point that out. Medicare Advantage. We're happy to announce that for probably over 120 or so of our Medicare Advantage members that are in the standard plan, the premium will remain at zero. So there's no increase for those that are in that plan. The Anthem Medicare Standard Plan will see a decrease of about $10 to $156.15. Medicare Advantage members that are in the United Healthcare Premium Plan option will see a $20 a month increase, and that's basically to make sure the subsidy between the standard and the premium is equal. And you see the rates at the bottom. UHC standard, 0. UHC Medicare Advantage premium, $168.22. Anthem Medicare Advantage, $156.15. And Anthem Premium, $325.88. Open enrollment this year will begin on October 16th through November 3rd. We will have in-person meetings as well as some virtual meetings. So those meetings are being planned. I now would like to reference, there are 3 resolutions that we're asking the board to consider. The first one is the member contribution. And this resolution addresses the member rates that we are proposing. There is an exhibit that was included with this resolution that will have the recommended rates for the 2024 benefit plan year, which is effective as of 1/1/24. The second resolution is the member contributions for the state employees plan, and it identifies the state employee for your contribution, and that's remaining the same. And then the final resolution is for the teachers plan in terms of those who are in those plans, and it references and reflects the changes in terms of the employer contribution for the certified employees. That was actually amended in the 23 budget, but will obviously be moving forward in the 24 budget. And let me point out that our benefit year runs on a calendar year, and obviously the state runs on a fiscal year, so we'll make sure we clear that. And it also identifies the public employee monthly rate for those who are non-teachers and also library participants. I will now pause and answer any questions that may come from the board, but we respectfully ask for your adoption of these resolutions.
Questions, comments from the board, please? Hearing none, I think for clarification for everyone that we're going through this for the first time, our responsibility here is what Lewis has presented as far as the board is concerned. Our being asked to approve plan design and rates. Things like vendor decisions and things like that are not the board's, not requested by the board, but that's the department's from an operational standpoint, like any other programs and vendors. So the plan has been, you put together the plan with by utilizing Aon as a consultant, and they've been our consultant in this plan for a few years.
Yeah,
and also included in that, as I understand, we compare our plan structure and design with neighboring states, so that we use that kind of input to look at how our plans are put together. And we've had a few years, as you pointed out, we're asking for some rate increases, or you are for this go around, and understandable when we look at the inflation and the numbers that you presented. But it's been a few years since we really had rate increases. So we have, I think for the most part, this could be expected at this particular time, that some increase would be required. So that's my comments. Any other comments or questions from the board?
I would like to comment, Cynthia Rucker. I just wanted to comment on the benefit enhancements.
Yes.
I really appreciate hearing about the 100% coverage. And I think you mentioned, Mr. Amos, that the mammogram coverage would start in, has already started. I think you may have mentioned. Did you mention about the retinal exam, the start date?
It's 1/1/24 along with the colonoscopy.
Okay, I can really appreciate that, because that's really going to decrease morbidity and mortality. So thank you for that.
Any other comments? Questions? Hearing none, is there a motion for approval for the plan design and rates?
Cynthia Rucker, I make a motion.
Dr. Rucker has made the motion for approval. Is there a second?
Shane Mobley seconds, yeah.
Motion has been made for approval and seconded. Are there, those in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and we'll look forward to a successful kickoff in October.
Thank you, Chair. Thank you, board members, for your support.
Thank you. That concludes our agenda items for this meeting under new business. During the last meeting, we appointed a nominating committee to review our 3 officer positions and make a recommendation, and we're going to ask for a vote at this time. This will become an annual review of officer positions. So officer positions will be effective for 1 year. And we asked David Cruz and his committee to make a recommendation. And at this time, I'll call on David for his report.
Thank you, Mr. Chairman. The Officer Nominating Committee is recommending to the board that we retain our current officers another year. Mr. Norman Boyd, of course, is chair. Dr. Russell Crutchfield is vice chair, and Dr. Cynthia Rucker as secretary.
Thank you, David. With that recommendation, like to ask, is there a motion for approval from the board on that recommendation of the 3 officers to continue for 1 more year?
Dr. Coles, so move.
Dr. Coles has made a recommendation for approval. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded that. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, and I think all 3 of us have agreed with David and the committee. If we were successful in being voted back in for 1 more year, that we would continue to serve in that capacity. So thank you very much. Does anyone know of any new business that needs to come before the board at this time? Hearing none, the meeting will be adjourned. Our next meeting will be August 24 with an emphasis on the budget. Thank you for your time this morning. Adjourned.